Can you imagine not being able to recognize faces of people you know, like your spouse, a best friend, or a coworker? Even your own face in the mirror? A disorder that impairs the ability to recognize faces is called prosopagnosia. It's also called face blindness. According to Carlson in our text on page 193, people with face blindness, which is a symptom of visual agnosia, can recognize that they are looking at a face, but they cannot say whose face it is. Even though from time to time we may forget a face of someone we may have come in contact with, the average individual may still be able to recognize a familiar face, but may not be able to place where they knew that person from. Even with visual noise, for example, we may be able to recognize the Mona Lisa portrait or a slightly distorted image of someone we're familiar with. This is not the case with people who are afflicted by face blindness. Face blindness is found in individuals who fail to develop the ability to recognize faces. This is called developmental prosopagnosia, which is oftentimes found to be hereditary. Then there are individuals who acquire the disorder through the experience of having a stroke or some sort of brain injury. The stroke may have caused a lesion in the brain, specifically in one of the areas that is responsible for face recognition. Facial recognition involves several areas of the brain. These visual pathways are the fusiform face area, which is more pronounced and is located on the right side of the brain, and can affect one's ability to recognize faces. The occipital face area, the posterior superior temporal sulcus, also known as the STS, and if we look at MyPsych Lab's media resources, we'll see that the amygdala is also included as having face selective neurons. As you can see in this picture here, it shows the fusiform face area. So now that we know what face blindness is and what areas of the brain, when damaged, are associated with the disorder, as seen here, what tests or research methods can be used to test for the disorder? Well, as we can recall from in Chapter 5 on page 151, an fMRI, or functional magnetic resonance imaging method, is often used to observe the brain's reaction to visual stimuli. Scientists may pay close attention to those areas mentioned, such as the fusiform face area and the occipital face area. When a patient is given a visual stimulus, such as an image of a face, they should be able to recognize. One particular study of face recognition using the fMRI method with patients of prosopagnosia was conducted by Murata et al. In 2001 at the Carnegie Mellon University in Pittsburgh, Pennsylvania. The goal of the study was to explore the differences in functional brain activation for two patients with face blindness in comparison with a group of normal control subjects to see if patients with the disorder would show a functional activation in their fusiform gyrus when viewing faces. What they found in the results of their study was that while patients did show activation in the fusiform gyrus with significantly more activity in the posterior areas than their control subjects, the activation was not sufficient for face processing. And we can see that in this picture here that the control group is on the far right and our two patients with prosopagnosia is on the left and middle. Another test used is the Benton Facial Recognition Test, or the BFRT, which is used by neurologists and neuropsychologists to assess face recognition abilities. The BFRT has a long form of 54 possible points, and subjects are presented with a target face above 6 test faces, and they are asked to indicate which of the 6 images match the target face. Scores greater than or equal to 41 are classified as normal, and what this study found was that patients with the disorder can score normally on the BFRT, as they tend to develop strategies for recognizing certain features such as a nose, eyebrow, etc., and that can aid in their recognition abilities. Now, I know many of us are hearing this, or after hearing this, may think back on the times that we ourselves may have shown some personal difficulty in recognizing someone. However, prosopagnosia is not to be confused with simple forgetfulness or memory decay. So before getting a case of psychology student syndrome, assuming you have this disorder, note that face blindness affects 1 in 50 people, which is about 2.5% of the population. However, if you'd like to test yourself, visit faceblind.org and take their famous faces test, like the one you see here, and see how well you score.